So a neuroma is essentially an enlargement of a nerve, and that is usually accompanied with some scar tissue and some swelling as well. Now within the foot we get what's called a Mortons neuroma, and that most commonly tends to occur between the third and fourth metatarsals. Now it's more common in women, and what tends to happen is if the metatarsals are squeezed together, then this irritates the nerve even more, and it feels like, well, the patient feels like they're walking on a small lump. Footwear doesn't help with this either. If it's too narrow, then that squeezes the metatarsals together even more. Or if the foot isn't functioning in its optimum position, then that can also aggravate an already enlarged nerve. Okay, so with a Morton's neuroma, one of the tests we can do is manipulate the metatarsals together, and what we're listening for is what's called a Mulder's click. So it's a slight clicking sound, and that might also be accompanied with some pain or some nervy type feelings, which the patient may experience, which they'll tell you. Now we can treat this again with off-the-shelf devices with something just as simple as a met dome, and the emphasis here is to try and splay the metatarsals while the patient is weight bearing. Moving on, we could use a custom-made device, and we could make this a little bit more bespoke, and we could do something like a firmer met bar, again to go between the two metatarsals, so that when the patient weight bears, that splays the metatarsals apart to take the pressure off the nerve.